for joining the webinar today to hear an update about our research in adolescent mental health. My name's Kate Maston and this is my colleague Ali Bartholomew, and we're researchers working at the Black Dog Institute, which is in Sydney on Gadigal and Bidjigal country. In this webinar, we'll be sharing an overview of the initial findings emerging from the Future Proofing Study, a very large long-term mental health study involving over 6,000 Australian adolescents. Just a brief overview of the topics this webinar will be covering. We'll start by explaining what the Future Proofing Study is, then we'll dedicate most of the webinar to talking through some of the early findings from the study. We'll wrap up by sharing some mental health resources that might be useful to you. But before we begin, we would like to flag that this presentation does contain some content relating to self-harm and suicidal behaviour in young people. Some of these statistics may cause distress. If you require support for yourself or a young person in your care, please reach out to a mental health professional or a helpline like Lifeline. So we're going to start by sharing the findings from a recent survey of mental health and wellbeing across the Australian population, conducted by the Australian Bureau of Statistics. In 2020 to 2021, 2 in 5 people aged 16 to 24 had experienced a mental health problem in the last 12 months. That's 40%. And around the world, research is demonstrating time and time again that rates of mental health problems amongst young people are rising. This pattern has been documented over the past 20 years or so, and despite a large body of research, there's still no scientific consensus to explain why this is the case. The Future Proofing Study was created to address these gaps in our knowledge. Starting in 2019, our team engaged with schools, parents and students to establish a large cohort study of adolescent mental health. Over 6,300 students agreed to participate in the study. Each student in the study has consent from a parent or carer and also provided their own individual consent to participate. Our team visits this same group of students at their schools in person every year from year 8 to year 12 to conduct an annual comprehensive survey of their mental health and wellbeing. Students are then given one final survey in the year after they've finished school. Today we'll be presenting the findings from surveys that students completed between year 8 to year 10. A lot of information is collected by the annual student surveys. Students have been asked more than 500 questions over the years, and you can see a snapshot of the survey topics on the slide. We're incredibly grateful to the schools and students who dedicate their time each year to complete these surveys. So this study has 3 primary aims. Firstly, to understand why mental health rates are increasing in young people. Second, to identify targets for early intervention and upstream prevention. And third, to use our data to inform education, guidelines and policy to improve youth mental health and wellbeing. To expand on that last point, we've been providing feedback from this study to schools, education and health departments and the Australian government in order to shape policy, service provision and the allocation of funding to support adolescent mental health and wellbeing. We're also working really hard to translate our research findings into practical educational resources and guidelines designed for families, schools and young people to use themselves. So who are the students participating in this study? So this slide shows the characteristics of participating students at the start of the study when they were in year 8. Now comparing to the recent census, these students are representative of young people in Australia at the moment, which means we can interpret the findings from this study as representative of year 8 students across Australia more generally. Now I'm going to pass you over to Ali to talk through some of the study findings.
Hi everyone. So to begin, this slide illustrates the overall prevalence rates of mental health symptoms in year 8 students. So as you can see, about 15% of students reported symptoms of depression, about 18% reported symptoms of anxiety, about 31% reported experiencing psychological stress, that's about 1 in 3, and nearly 5% of students reported suicidal thoughts, which is very concerning. That's about 1 in 20 students, and if you think about it, it's equivalent to about 1 student in every year 8 classroom across Australia. We also found a significant gender difference across these mental health symptoms, with girls reporting symptoms at about 2 to 3 times the rate of boys. And mental health impacts more than just mood. As we can see here, in year 8, students with depression were 3 times more likely to have tried alcohol or cannabis, 3 times more likely to have problems completing schoolwork, 4 times more likely to have engaged in intentional self-harm, 6 times more likely to have difficulties with daily self-care tasks, and 11 times more likely to have seriously considered suicide in the past year. Concerningly, we found that rates of intentional self-harm were high, so even in year 8 students. As you can see here, 15% of male students, 26% of female students, and 63% of gender diverse students reported having intentionally harmed themselves once or more. This does fit with data coming from Australian hospitals about self-harm presentations to emergency departments, which shows that the peak age for self-harming is now around the age of 14 and is getting younger. This is a significant area of concern and something that we're really investigating in more detail as the study progresses. We also found that students who identified as sexuality or gender diverse were particularly at risk of experiencing mental health symptoms like depression and anxiety. They also reported higher rates of bullying, feeling less safe at school, and feeling less connected to peers and their teachers. Clearly, these symptoms are, not happening in a vacuum. And while we have made huge advances with diversity and inclusion in recent years, this data really does tell us that we still have a long way to go to address the stigma and discrimination experienced by the LGBTQIA+ young people. Now, I'd like to talk you through some of the risk factors for anxiety and depression that we're actually beginning to identify. And that's really one of the key strengths of this research, is that it is longitudinal. So what that means is that we can actually examine trends in the data over time to better understand the causal factors that could actually put someone at higher risk of developing mental health problems in the future. So we conducted a statistical analysis exploring which factors in year 8 put students at higher risk of developing symptoms of depression or anxiety by the time that they were in year 9. So across the 1-year period from year 8 to year 9, we found several significant risk factors for the development of both depression and anxiety symptoms. These were being female or gender diverse, being sexuality diverse, rating family relationships as unsupportive, experiencing low connectedness with peers at school, and having sleep problems like insomnia or poor sleep quality. Additional risk factors for the development of depression were higher hours of daily screen time and exposure to adverse childhood experiences, which refers to highly stressful or traumatic events in childhood. Finally, living in a separated parent household was a risk factor for the development of anxiety. It's really important to note that this list is not exhaustive. So while we did investigate a really broad range of possible risk factors, there are many, many others that we're actually unable to include for logistical reasons, such as genetics, which we do know plays a really important role in a person's mental health and well-being. I'll now pass over to Kate to spend a bit of time speaking about 3 of these factors, so peer relationships, sleep, and technology use in a little bit more detail.
Sally. So first I'd like to talk about peer relationships. As with all of us, having supportive, trusting relationships with other people is integral to our health and well-being. But this is especially important for adolescents, as teenagers are beginning to look more towards their peers for guidance, information, and support. Fortunately, roughly 3/4 of students surveyed in Year 8 reported strong feelings of peer connection at school. However, on the flip side, approximately 1/4 of students felt like an outsider or that they don't belong at school. Bullying also continues to be an issue for many students. In Year 8, 12% of girls and 11% of boys reported being bullied regularly. 14% of students reported having bullied other students, and 22% of girls and 15% of boys reported ever having experienced cyberbullying. We also found that 17% of Year 8 students overall reported feeling lonely at school. Rates of loneliness were approximately twice as high in marginalised and minoritised groups of students, including those who were sexuality or gender diverse, from socioeconomically disadvantaged backgrounds, and those who reported having a physical, developmental, or learning disability. So let's think about what we can be doing to address loneliness and improve peer connection amongst young people. So the first thing we'd recommend is identifying the need in your school or area. And every school is going to be different in terms of the categories of minoritised and marginalised students. So reflecting at a local level is really important to work out which groups are most likely to need more support in building social connections. And we'd also suggest incorporating the student voice here. So working with students, particularly those vulnerable groups, to devise ways to tackle loneliness, because they'll have really unique insights into how these young people can be supported both in school and out of school. It's really important that this is taking place within an overarching culture of respect that values diversity, and this is something that most schools are already doing and many schools do incredibly well. And we know that this has a strong evidence base in terms of improving connection and reducing loneliness. Again, it's important to understand students' views on this, so before implementing anything new, try and find out how students perceive these plans to promote this positive and caring environment. It's also essential to have in place clear anti-bullying policies and safe reporting mechanisms. I also recommend providing opportunities to build social connections, because social connections are absolutely crucial for reducing loneliness, and they have positive knock-on effects for mental health and well-being. So this could be done inside the school day with extracurriculars and school clubs, but also it's important to build connections within the wider community. And there are a wealth of opportunities where young people can really build those connections with people their own age, as well as younger peers and adults. And finally, just taking every opportunity to help young people to learn and refine their social skills is going to be key in developing these skills. And the resources that I'm sharing at the end have some great advice about how to approach this.
So another key issue for young people is sleep. We're really interested in finding out about sleep because it's important for practically all aspects of health and daily functioning. What we found from our surveys with Year 9 students is that about only half of all students are getting more than 8 hours of sleep each night, and about 1 in 5 are sleeping less than 6 hours per night. Unsurprisingly, 31%, or about 1 in 3, reported feeling quite or very tired during the day. And what we know about adolescent sleep is that their needs are actually really quite unique and very different to younger children and adults due to the significant developmental changes that do take place during this life stage. So what we do know is adolescents need about 8 to 10 hours of sleep each night, and usually take longer to fall asleep than other age groups. They typically begin to feel tired later in the night, so about 11 p.m., and wake up later in the morning. And this behaviour is completely normal and developmentally appropriate. But it does mean that it's harder to get up very early for school or other activities in the morning. And this is likely to be a really big driving force behind the chronic lack of sleep that teenagers are reporting everywhere. We know that insufficient or poor quality sleep is a major risk factor associated with mental health and well-being in adolescents. And in our study, we found that sleep problems are linked to difficulties with schoolwork and attendance, problems with peer relationships, and 4 to 6 times the risk of experiencing mental health symptoms like anxiety or depression. Fortunately, in terms of taking action, there has been a lot of research into sleep, and a lot is actually known about what can help adolescents to establish healthier sleeping patterns. So firstly, it's really important to provide students with education about the importance of sleep and how they can set themselves up for success when it comes to sleeping. Particularly important is establishing a really regular sleep routine, so setting consistent bed and wake times throughout the week, and this includes weekends. Also stress the importance of reducing screen time for about an hour before bedtime. We'll go into this in a little bit more detail in a moment when we talk about screen use. Also, a consideration of adolescent sleep needs is really warranted when planning early morning classes and extracurriculars. Of course, sometimes this is really unavoidable, but if the activity could work at lunchtime or after school, that might be a better option to allow adolescents that important extra sleeping time in the morning. And finally, it's really important to screen for and be aware of genuine sleep disorders like insomnia or sleep apnea. These are not uncommon and warrant professional assessment and advice. So if you would like some practical advice to help a teenager in your life set up healthier sleeping habits, the Black Dog Institute have actually recently released an evidence-based app for teens that not only teaches practical sleep skills, but also allows them to track their sleep and better understand the links between sleep and mood.
And finally, I'd like to discuss the role of screen use in young people's mental health. So we know that adolescents spend a lot of time online and on social media platforms, and there is a lot of discussion about social media and the impact that it might have on mental health, and it can be quite difficult to unpack all the conflicting information. So at this stage of the study, we're just beginning to gain insights into the link between screens and adolescent mental health, which I'll share with you now. But firstly, how are adolescents using screens? So this data comes from surveys completed with Year 10 students this year. And you can see that the majority of use is related to watching video content, social media, and generally using the internet as an information tool. And this is probably not too dissimilar to how most adults use technology. Fewer teens are gaming, and fewer still are using technology in creative ways to generate content. We found that students were averaging at least 2 to 3 hours per day on social media, but there is a wide range of usage, and the most common platforms were Instagram, Snapchat, and TikTok. 82% of students said that the main way they use social media is to communicate with their peers that they know in real life. And this is important because social media is now an integral part of adolescents' daily lives and how they interact with their peers. Some people have suggested that the increase in social media has led to an increase in loneliness for young people. However, relatively few students in our study said that using social media stopped them from seeing their friends in real life. We also asked students whether they felt that using technology stopped or delayed them from doing other important things in their life. And 46% of students reported that it did. The main activities impacted were homework, doing chores, and sleeping. And this matters because, as we just discussed, adequate sleep is incredibly important for mental health and functioning in adolescence. 80% of Year 10 students said that they use screens in the hour before going to sleep. And almost half of those students felt that they went to sleep later than they wanted to because they were using screens. But how is screen use related to mental health? So now here we're sharing data provided by students when they were in Year 8. So that's over 6,000 young people with an average age of just under 14 years. This graph shows the relationship between hours spent on a screen per day and the percent of students who met criteria for clinically significant depression. And as you can see from the graph, the more hours of screen use per day, the more likely it was that a young person was experiencing depression symptoms. And this relationship was particularly strong for girls. In fact, more than a third of girls who spent 5 or more hours online each day met criteria for depression. So there is a clear relationship. But does screen use cause depression? Well, this is where it gets complicated. When we looked at how screen use and depression are related over time, we found that the relationship is bidirectional. This means that over time, screen use and depression influence each other. So an example of that might be that feeling low leads to high withdrawal and screen use, which in turn may impact mood due to reduced physical or social engagement. And also, it's important what you're exposed to online. So some negative examples might be body image comparisons, cyberbullying, or self-harm content. And you can see how this could quickly become a vicious cycle. So we really do need more data to better understand the nuances of this relationship. More and more research is showing that actually it's what adolescents do online rather than how much time is spent online that's more important for mental health. And we do know that things like being exposed to self-harm content or posting inappropriate content online and then regretting it seem to be problematic. But keeping in touch with friends outside of school via Snapchat, perhaps not so much. And as we discussed earlier, peer connection and belonging are extremely important for young people. So our data is starting to show that screen time and depression likely influence each other in some way. However, it is important to move away from overly simplistic approaches of seeing screen use as either helpful or harmful, and instead consider the nuances of for whom and in what ways screens and social media affect mental health. Emerging evidence seems to suggest that a more active guidance seems to have a protective role and may be useful for supporting adolescents to use the internet more safely. We know that unhelpful and harmful content continues to be easily and widely accessible by adolescents. So technology companies really do have a responsibility to provide safe online environments to minimize the risks to young people. But beyond that, educational and family settings are also really important points of contact where young people could be guided and encouraged to reflect on their screen use to prevent things like cyberbullying or from engaging in that more risky online behaviour. We're also seeing that screen use is displacing other important activities in life, particularly sleep. However, I would like you to reflect for a moment on how you went to sleep last night. Often us adults are using screens just as much as our kids, so it is important to be aware of how we're modelling screen use in the home. And I think we all know that it's important for us to be setting boundaries for screen use and to take regular breaks and to balance our screen time with other physical, creative and social activities. All in all, this is a complex issue that requires involvement from multiple levels of society to work out the best way forward. In the meantime, we've added a host of extra questions into our student surveys to try and understand this issue in more detail, and we'll be able to present on those new findings next year. We also just want to acknowledge the students in this study and how important it is for us to be sharing their data back with them in engaging ways. So our team's been on the road delivering presentations to students at school about sleep, and based on student feedback, we've created a hard copy poster with some of the key study findings for schools to pin up in their common areas. So please do reach out if you'd like a copy of the poster. And that's it for now. Thank you so much for listening today to our early findings. And we are hugely grateful to the students, schools and families who contribute to this research. Please feel free to share this webinar with anyone that you think may find it useful. We want the voices of these young people to be heard by as many people as possible. And if you are looking for resources to help you support young people's mental health and wellbeing, these websites do address many of the topics that we discussed today, including peer relationships, sleep and screen use. And also Headspace offers free counselling and support for adolescents and their families.
So please do reach out if you have any questions at all or ideas about our research. And thank you so much for your time today.